Hello everyone, thank you for joining us for this next video of this series of video vignettes on endometriosis. Today we're going to tackle a very important issue, which is the question of, is a patient with endometriosis going to need surgery every 1 to 2 years for the rest of their life, or at least until they want to get pregnant? We're going to address this question with our study on excision in teenagers. But before we get to that, let's talk about what the status quo or the usual thinking is, which is that endometriosis recurrence is between 50 and 80% in every 1 to 2 years. Where does this data come from? Well, it's done from surgeries or studies on ablation surgery, where they look back every 1 to 2 years and they see endometriosis again. Now, what is happening here is probably not that the endometriosis keeps coming back. More likely what is happening is at the surgery, they're not treating all the disease. They're not getting around the patch of endometriosis. They're not getting under the deep disease, under the roots. They're just burning the tip of the iceberg or a little bit here and there, and they're looking back and seeing endometriosis again. But they're probably looking at the same disease or partially treated disease from previous surgery or from the time before. So in our study, it's still the largest prospective study done in teenagers after excision. The majority of patients had tried hormonal suppression of some kind, either chemical pregnancy with birth control pills or induced chemical menopause like with Lupron or Orilissa. The majority of patients had actually had multiple surgeries by ablation before receiving optimal excision surgery. We looked back at almost half of patients, about 45% of patients, and that gave us a chance to look for endo again. And the rate of finding endo again, on average in 2 years, was 0. So we take away 4 points, very important points from this study. 2 are reminders of things we kind of know already but need to be reminded of, and 2 are important paradigm shifts. What are the first 2 points? Number 1, treating endometriosis helps pain. We know that, and in particular, pain with periods, even though by definition, endometriosis is outside of the uterus. How or why is not as important as the fact that treating endometriosis well does help pain and quality of life. The patients described less pain and better quality of life. Okay, the second reminder is, not all pain is endometriosis. Persistent pain, recurrent pain was the reason to look again, even though they felt significantly better. But when we actually went to go look, there was no endometriosis, and we took random biopsies. So we have to do better about treating other sources of pain, and we are doing better with that. We have a pelvic pain center now. We are better at treating the other non-endometriosis sources of pain. And now our rate of repeat surgery is about 6%. That's not published yet, but it's much lower, can be very low. So treating endometriosis does help pain. Reminder number 1. Reminder number 2, persistent or recurrent pain does not mean the endometriosis is back. And we would look at, or need to look at, other sources of pain first before revisiting the issue of the need for surgery again. The next 2 points are paradigm shifts and very important. Number 1, for the most part, for most patients who receive good excision surgery, it is one and done. This is amazing. This is a paradigm shift. The rate of finding disease again was very low, or can be very low. That means you don't have to expect to keep doing surgery every year or 2 and just burn the tip of the iceberg. That if you cut it out well, the chance of it coming back or being missed can be very low. There is no cure, nobody's perfect, but the rate of repeat surgery can be low, about 6%, at least for sure under 10%, and the rate of finding disease again can be very low. Paradigm shift number 2 is that long-term hormonal suppression is not needed to achieve a low recurrence or persistence rate. In our study, the majority of patients did not take hormones after surgery, and many patients wanted to use the time after surgery to get off the hormones. and still no endo was found in 2 years. So I always am wary of a patient who tells me their doctor told them they got all the disease they could, but by the way, they were recommended to be on Lupron for 6 months. That tells me they know they didn't get it all, and they're trying to use hormonal suppression after surgery to mop up the rest or keep it away. Our study shows that if you actually cut out the disease well in all of its forms, not just the typical black spots, but also the atypical brown, red, white blisters type of lesions that are more common in younger patients, that the rate of it coming back or being missed can be very low. So again, 2 very important paradigm shifts. Number 1, after good excision surgery, it is typically one and done. And the rate of finding endo again or needing surgery again can be very low. And 2, long-term hormonal suppression is not needed necessarily to keep endometriosis away. So let's get the word out. Women deserve better. Thank you very much.